Fascial releases of the crosshands variety are really important for the thoracolumbar fascia. It's important in ensuring that you remember the association of glute max, QL, how the lats actually communicate across the body all the way up to the anterior part of the shoulder. And so landmarking here is super important. I like to choose just above the iliac crest. The heel of my hand kind of comes into that space that bows the QL just a little bit, but also gives some attention to maybe the iliolumbar ligament, right, at L4. The opposite hand, it's just going to kind of, at the border of where those low ribs initiate, T12 through T10, just giving a little bit of the ulnar border of my hand. Now this is just landmarking. As I start to load fascially, I want to be aware of both hands, of the tissues as I sink down into them. I've got the ribs under my left hand, those floating ribs. My right hand has QL, but my fingers have just the abdominals, right? And those are engaged as well. So as I get down to position where I've actually got some tension on the muscles I'm trying to release, then I start to compose a little bit of torsional force, maybe some skating or sliding, and just trying to create a dance between indirect techniques. Sometimes I actually move from direct to indirect in the same sort of movement. And I don't know if anybody's done work on this. I just kind of, it feels right. I've had good results with it. But occasionally I'll just sort of skate into a position that approximates the tissue and then drop it back, almost moving with the breath or following it. And to me, this feels very fascial. QL in particular is one of those big fascial groups, and it has such influence across the whole body that it's nice to hang out and spend your time on this one. John Barnes talks about fascial work really requiring at least 5 minutes to get the full release. We need to follow where the tissues are going, where they are leading, right? And especially as we work around that axial structure, so much of it is composed off of that midline sensibility that the central channel of the spine provides. And so, you know, continuing to unwind, following the tissue where it wants to go, seeing if I can track that line of tension, and watching it recompose itself. Once I've got some, if not all, of the release that I've been looking for, just allowing the inhale to kind of bring me back out of it. I can get a sense of how things have moved. It's just so fair that there's some nice hyperemia that comes to the heat of the skin as the blood's circulating. I'm gonna reassess and then try this on the other side just to see what moves, and then reassess again.